Patrick Charmel.
Senator Farfara, Representative Horn, I'm Pat Charmel. I'm the President and CEO of Griffin Hospital. I have the privilege of serving as the Chairman of the Board of the Connecticut Hospital Association. Thank you for the opportunity to speak to you today. I did submit written testimony, which is fairly detailed. I'll just highlight a couple of points, and I'm available to answer any questions that you have. I am speaking in opposition to the provider tax provision in SB84. As you know, the current hospital provider tax has a disproportionate benefit to the state of about $508 million for the state and $124 million to Connecticut's hospitals. That's not consistent with the intent of these programs from the federal perspective that actually makes additional federal funding available through this mechanism to allow states to provide hospital payments that cover the cost of care. So clearly Connecticut hospitals are disadvantaged about the way Connecticut currently implements this program. Now there are some opportunities for us to work together to adjust the tax program to leverage more federal funding. I want to point out that 33 states have taken advantage of a mechanism that's now been eliminated called directed payment, where hospitals in those states are being paid Medicaid rates close to the average commercial rate, which in our state is more than 3 times what our current Medicaid rate is. The consequence of us and our underpayment is about $1.5 billion to hospitals, and the underpayment to physicians is another $250 million. Hospitals attempt to shift that shortfall to commercial payers, which is a burden for the state's employers and ultimately to consumers, because employers are pushing more and more of the cost of private insurance to employees who can no longer afford it. In addition, again, this worked just barely, but look what we're facing now. Because of H.R. 1, Connecticut expects to see half of the expansion population, up to 150 Connecticut residents, losing Medicaid coverage come the first of the year. That means there'll be a problem with access to care, which is, from a public health standpoint, a travesty, but it will result in more uncompensated care for hospitals. Could be as much as 2% of revenue when hospitals in this state are barely breaking even from operations now, and many are losing money. And that's just one of many things that we're facing. Also, because of the enhanced tax credit being lost, even though the state is stepping in, on the exchange we see more and more consumers stepping down to lower level plans that they might have
3 minutes. Please summarize.
They might have a lower premium, but they have more out-of-pocket expense. And the consumers who are trading down to protect themselves from higher premiums don't have the ability to pay those higher out-of-pocket requirements in those plan designs. So that means, again, barriers to access to care and more bad debt for hospitals who can't afford it. So again, in summary, we have an opportunity to work together. The window is closing. The federal government is looking at provider tax programs. They already shut down the ability for new directed payment programs, which would have been a boon to us, and the administration was working with the industry to try and exploit that. That's gone. We have an opportunity to increase the take from the federal government to be able to provide fair and appropriate payments to hospitals. We can't let this opportunity pass. Thank you for the opportunity to speak to you.
Senator Cabrera.
Thank you, Madam Chairwoman. Pat, how are you?
Very good, Senator. Nice to
It's
see
so
you.
good to see you. Thank you for coming and testifying today. I know you're testifying in your capacity as chair of the association, but I was wondering if you could tell me a little bit about how this would impact a hospital your size in Griffin in Derby, which, as you know, compared to the other providers we're used to seeing, is a lot smaller. But mighty. I know you guys tend to punch above your weight, but but serve
Appreciate that.
a very a population, an Alice population in my district that has high needs, and how something like this would impact you on the ground.
Yeah, Senator Cabrera, thank you for that. I mean, Griffin sits on Division Street in between Ansonia and Derby. The residents of those two towns, 50% live in households that can't afford their basic living needs. So the things that I talked about with this shortfall in government payments, not only from Medicaid, but from Medicare as well, and actually Medicare Advantage is even worse, right? We don't want to be in a position to be able to have to shift costs to commercial payers because we know the people that we serve can't afford it. That's one. Again, what we're seeing is because of these shortfalls, hospital margins are shrinking. We are not making money from operations this year, which means we have to dig into our limited reserves. But we've lost independent hospitals in this state. Just in the last 5 years, we've seen hospitals become insolvent. Right? And they're required either the state to take them over or to join another system who promised them the resources they need. That hasn't worked out necessarily for those hospitals. So you're right, independent hospitals, especially smaller community hospitals like ours, are probably more challenged. But this is something that cuts across the industry. And the proposal that we have to work with the state to leverage more federal dollars, we want the benefit to be proportional. We want to help every hospital in the state because each has its own unique circumstances, but they all are struggling right now and need support. So thank you for the question.
Thank you, Pat. I appreciate your testimony today. Thank you for lending your voice today. Thank you, Madam Chair.
Thank you, Senator, and thank you for being here today.
Thank you.